That about 20% of the ischemic stroke is caused by vertebral basilar circulatory insufficiency. And in the background, we can find either basilar artery stenosis occlusion or vertebral artery stenosis occlusion. And this part of the ischemic stroke is rather neglected. To tell the truth, the anterior circulation, the carotid area is much more popular, if you wish. Many information, many papers have been published regarding what is the optimal therapy, medical, non-medical, if non-medical, then stent or operation. But the vertebral artery stenosis is as I mentioned before, a little bit neglected one. Because about 10 years ago, the American Stroke Society published a guideline suggesting the colleagues to be very cautious about the vertebral stenosis therapy because the distal location can be associated with side effects and complications, and very few study dealt with the proximal. Proximal means that near to the heart. And as I went through the literature, I have realized that the problem is not totally solved, if you wish, because some important randomized control prospective trials had to be finished earlier, prematurely. And this is always a problem because the strongest evidence is always a randomized multicenter prospective study. And two of them had to be finished prematurely. That probably could have answered the question. And my task was to go through on the many different single center studies. Some of them were very well organized, some of them were poorly organized. But finally, I had the impression that if the symptoms are related to the vertebral stenosis, not and proven and technically feasible to mention and to make some intervention, then the proximal vertebral stenosis should be stented. So we focused our activity on the anterior circulation, similar to others. Personally, in my career, 40 years old career, I had, of course, patients with vertebral stenosis, and I was always very cautious with these patients. But if we could prove, for example, that the MRI abnormality has a strong relation to the ipsilateral vertebral stenosis, that we suggested the interventionist to perform this stent. But only, as I mentioned also in my lecture, I would be more active in the proximal stenosis, not in the distal one.